In elementary school, we're taught that we have 5 senses. What if I were to tell you that our teachers left out an important one? Proprioception, considered to be our 6th sense, is the awareness of limb position in space, and it is essential for coordination. Some athletes, such as Stephen Curry, who is regarded to be the best shooter in basketball history, even get paid millions due to his highly developed sense of proprioception. It is the reason he is able to recreate precise arm angles during his shooting motion, though you don't have to be a professional athlete to make use of proprioception. You use it every day without having to think about it. It allows you to walk without having to look at your feet, for example. How are we able to sense limb position, you may ask? Well, in our muscles, we have sensory organs called muscle spindles that sense these changes in muscle length. Nerve fibers attached to these spindles then relay that information to our brain. From there, motor neurons are activated, which elicit a response from our muscles to correct or tune any movement. For Steph Curry, muscle spindles embedded in his bicep are letting him know what angle his arm is creating so he can let go of the ball when he wants to. Can you imagine if he didn't have this sense? He wouldn't be able to run without looking at his feet, and he'd be the worst shooter in basketball history. The sympathetic nervous system is responsible for our fight or flight response, and it is activated during stressful situations. My team is trying to determine how the stress response affects proprioception by treating muscles and the muscle spindles within them with drugs that mimic the SNS. After treatment, we subject the muscles to stretches and observe the signals from the nerves fibers attached to the spindle. Preliminary data shows that these signals are diminished after the drugs are added, suggesting that the stress response impairs proprioception. To find the receptors that are being acted upon, we are using drugs that specifically bind to different receptors of the sympathetic nervous system. We found that by targeting one type of receptor, the alpha-2 receptor, it caused a similar pattern where the signal diminished, suggesting that these are the receptors acted upon by the SNS. These findings are of significance because there are many diseases that are associated with increased SNS activity, such as obesity, anxiety, and diabetes. Therefore, people with these diseases could suffer from a lack of motor control, making them more susceptible to falls and injuries. With more insight, we can figure out how stress affects our 6th sense, and it would allow us to treat SNS-related proprioceptive deficiencies in the future. Thank you.